Back again. Welcome, Jason, to the third episode of our chat about
third, but not the final.
About all things design. When it comes to the Locum's Nurse suite of products.
Yeah.
And last time we discussed how during the pandemic we developed a series of features within the app that were focused on improving the well-being of our user base, and that includes healthcare professionals, all sorts of healthcare professionals now, not just medics, and the background teams that are supporting them, and those are rota coordinators, rostering teams, staff bank teams, HR directors, chief executives of hospitals, and how we brought them all closer together.
So the whole bowl of soup.
Yes, exactly. So we gave ourselves a brief, and we said the profession is exhausted, and this is just the beginning. That was in the early stages of the pandemic. This is just the beginning, and we need to give them the flexibility in the work-life balance, but also focus on improving their general well-being through the mobile app within our means. Of course, we're a shift booking platform at the end of the day, right? So within that constraint, how do we improve the well-being?
Some of the stress of them.
Right, and you did a lot of research. So a lot of what you do is research and development, right? So you did a lot of research, and you came down to one concept that is modern and critical in improving that well-being, and that's the concept of microinteractions.
Yes.
Could you define microinteractions for me, and where you've seen them before?
Sure.
What are they and why they're important?
Sure. So microactions have kind of become quite big over the last, year. I would say, maybe a little bit before that. But microinteractions are small kind of reactive features that we've now become so commonplace we don't even know that they're happening, but what they're doing is they're drawing our attention to things that the products want us to do, to interact with, and they're a way of kind of embellishing on what they're offering you. And for example, Twitter, for instance, now if you look at the love heart, when you like a message, rather than just going from outline to read, it kind of you get this nice little kind of fill and post,
little animation, right?
Exactly. So it offer much in terms of in terms of to your actual
function?
Nothing. But what it does is it's an emotional response. It's making liking this more special.
It gives you that tactile stimulus with the other end. So the other user, so the person that posted that tweet, you're giving them a thumbs up or a like or a heart. Right?
Yeah. You're not just liking it, but you're liking it with love, because it's you know what I mean. So it's embellishing on some of our emotions and some of our interactivities as well within products. I mean, these have been becoming. I would say even Facebook. There's a lot of stuff behind the products we use that kind of almost have a level of experience, if so to speak. There's the common actions, but then you're almost rewarded for finding hidden actions. The idea of swiping to reveal more options, a share function, a like function. These things reward the user, and they reward your sense of you becoming, I'm now expert level with this product.
Yes, so you're learning to use it. But what's interesting here is that we've taken that concept that's been used in social media for reasons or to increase engagement of the users. And we saw them as a way to improve what we call the digital touch point between management of a hospital and the frontline teams.
Yes.
Right? And so we're giving each group a way to interact with each other through the app.
Yeah,
right?
We took those emotional responses and created more action-based responses for both parties.
Exactly. And remember, the brief was about improving the well-being of the user base, the profession. And how do you do that? You do that by bringing the management closer to the frontline profession so that they can understand each other better, they can empathize with each other and show each other that they care, right? And so we've taken that concept, which is quite new, it's quite theoretical, and applied it in the Locum's platform, which its core function is shift booking, right? Now, the features that came in, and I'll be naming them and you can describe them, are varied across the app, right? Let's take the first one, which is creating a wish list of your shifts, and how that wasn't good enough for us. And we wanted to make it special. We wanted to improve those digital touch points between doctors when it comes to even doing the basic of saving a shift. Yes. Could you describe to me what you've done?
Yeah, so we wanted to make it, we wanted doctors are moving around, and our app requires you to be stationary. Well, not stationary, but it requires a moment of your time to be, browsing shifts. But and what we wanted to do was to give the doctors the ability to see a shift and, I don't have time to go through it all now, but I'm just going to save that. Yeah. So it was the ability to save a shift and then come back to it later. But we could just stop there. So we were like, okay, we want them to do that, but still, we want them to act upon these,
decide what they want to do with
exactly
at the end of the day later.
And then, quite simply, it was the idea of again with love, we added a heart. I like this shift. I love the look of this shift, so I'm saving it. But what we also wanted doctors to be aware of was that you're not the only one who loves this shift. So it was simply that you saved the shift, but then all of a sudden, boom, you see another heart. Oh, what does this mean? It means that someone else within your hospital also likes this shift. So that there was kind of more of an incentive on you to to go back to it, take the time, see if you like the shift, and and apply for the shift
if you want to. Exactly. And so we have the concept of the double heart.
Yes.
So almost like watch out for the double heart,
exactly.
And that reveals a bit more information about that shift, is whether others are applying for it. Now, of course, the aim of the entire NHS in the cases of shifts is to fill as many and provide as much healthcare as possible to our patients, right? So the concept of shift fill rates becomes very important, because that's how we deliver care, right? And so that little feature, that little window into what's happening behind the scenes, is massively improving fill rates. Right, so that's one, creating a wish list and watching out for the double heart. Now, let's talk about sharing a shift, and that goes into different levels. I'll quickly describe it. So you swipe, you press the share button, and then you can start a chat group with other colleagues of yours, much like you do with other apps. Exactly, and but it's about that shift.
This was a really interesting one for me.
Really interesting design feature, because what you've done here is you brought in chat groups and established practices there, but you've also made it still about that shift. So we're bringing all the professionals, the team that is working on that shift that day together, so they can kind of get to know each other first, and which is essential in establishing good teamwork. but also you brought in the concept of the owl bot. Right, the owl bot for
the all-knowing owl bot.
Exactly,
yeah.
Right? And we like our puns, right? So it's a robot owl, which interacts with the users again, and takes away the unnecessary bureaucracy that a manager or a doctor has to go through, and it does it for them. So, for example, there's a feature within the sharing where a rota coordinator or a hospital manager can pre-match a doctor to a shift.
And we know for experience that within the various organisations, the rota coordinators tend to then have relationships with...
personal relations, and they know people, they know when they're free, they know whether they're good for that shift or not. So they say, look, I'm fast-tracking you into that shift if you want it. But what's key here, what we've done differently, is that it is still if you want it. And I've seen countless of times before people being put in a shift without their knowledge or their consent, especially when it comes to these vacant and additional shifts. And again, that's not respecting people's
Which goes back to wellness.
Exactly, right? So what we've done here is that the rota coordinator will initiate the pre-match, which will take away the any middle steps, and the doctor, the healthcare professional will receive a notification and a chat in a chat group that says, you've been pre-matched to this shift, do you want to accept it?
Which is power on their part. And,
exactly.
And it's the freedom of choice. Yes, I want this. No, I don't want this.
Essential to well-being.
Yeah.
I can't stress this enough. It is making your own decisions at a micro level is essential to maintaining control about your work-life balance, right? Which is key in well-being.
But it's the same, I suppose it's for anyone, with any employer.
With anything, right?
Yeah, if you feel the employer has taken away your civil liberties or your rights to your job, then, after a while you become ticked off and disheartened.
Exactly, which is what we're being proactive about.
Yeah. And
we're supporting our colleagues in that. We've and I don't want to be negative. I think there's a positive angle to everything, which is what we're doing. But 1 in 3 healthcare professionals said they would be probably leaving the profession, or thinking of leaving the profession recently, right?
Yeah.
That is a call to action for people like us, right? It's a call to action for us to improve, and we were proactive about it and already took steps towards improving that well-being. And so,
essentially, if the well-being of our users is always in mind, then we're all, we've kind of all, we've already had the insights into knowing that we were quick to act with this.
You put your energy into thinking how to improve well-being, right? Which is key. Now, the third feature I want to discuss is how we blended in the experience of browsing for a shift and booking a shift. Stories, bulletins, surveys that say a hospital CEO or a hospital HR director or communications team can send out to their teams. And we've all been there as frontline healthcare professionals, where there's an email that comes into our inbox that you never read it. So it's about reaching your workforce, right? It's about giving your workforce the tools to be included in that conversation, in decision making, and doing it in an easy way. Because if you make it in a way that is an endless form to fill in, nobody's going to give you that time.
No.
We
realised that we could step in, we could soft touch step into our user base's kind of everyday lives and allow the hospitals or the GP trust or whoever's on our platform the ability to talk to their users and reach out. And it was a way for them to kind of collate feedback.
Feedback, right?
Feedback via surveys, or just to let staff know of special incentives or things that were happening through the hospital trust, or which is just that extra level of just that extra level of care.
Level of care, and making people aware that you want their input.
Yeah.
And so I'm going to turn to the camera. Product placement alert. If you're a CEO, an HR director, or a medical director, and you really, truly want to speak to your professionals, to your frontline professionals, and gather their feedback and their thoughts about anything that concerns them, as small as the doctor's mess or as big as their number of hours they work, then you need to think about how you're going to do this and how you're going to reach out to them properly. And back to you now. And you've done that very well, right? You've done it extremely well. It goes back to that original episode of the car, right? You tap on it, it expands. It doesn't waste your time. It gives you a bit of a snippet. And if you want to read more, if you want to start a survey, then you will. But if you don't want to, you won't be forced to.
Well, it's that whole kind of seed, sapling, tree. We start with the seed. If you want to know a bit more, you get the sapling.
Yes.
But then if you want to get the whole lot, go to the tree.
But that's only if you want to.
Only if you want to.
And what's that enabled us to do is us to communicate with our users better as well. And we've now been able to bring to them services that improve their well-being, such as the latest example of Nourish, which is a mental health service and an app for parents who, imagine if you're a parent, you're a doctor, you work night shifts, weekends, and you have toddlers in the house, right? It can't be more stressful than that, right? And so being able to give to those users free help from really best-in-class services that can do that, that's
again,
super important.
It's us making those connections and empathy being the kind of
driver, and that's the digital touch points that we've brought in and improved.
I mean, they call them micro-interactions, but they have big benefits if done well, and we've managed to kind of figure out, the best way to use them. Because one of the things we talked about very early on was, was gathering, seeing how our users interact with the product, not giving them any big wow, animations or whatever, keeping it all very kind of tactile. But then as we've noticed, as our user base have grown with us, and and then new people come on, we felt that now let's start looking at how we can embellish on a lot of these kind of key features and just and boost them.
And so with that, I'll take two words that you said: small actions, big impact. And that's what we're all about.
Amen. Oh, brilliant.